Okay. Next is when starts melatonin secretion in complete day, in whole day. When starts melatonin secretion and when stops? Yes, Anita ji. When start and when stop?
When during night time and my early morning it will stop.
Nearly. Just say when darkness starts, then melatonin secretion starts.
Okay, ma'am.
Okay, and as darkness is going
Reduced.
stop or waking morning, then we can say melatonin secretion stops. In our whole day, when we get high BP, means very high in blood pressure in whole day. When we have high blood pressure in whole day. Sarthi ji?
Around 6 when we wake up,
And
and evening in the evening around 6.
yes. Very good. Okay. Next, which neurotransmitter is associated with wakefulness? Which neurotransmitter is associated with wakefulness? Is Usha ji?
Ma'am, serotonin.
Yes, very good. High level of serotonin are associated with wakefulness. Next is what's the effect on sweat secretion during sleep? What's the
Increases.
effect on? Yes, Simon ji.
Sweat secretion increases during sleep.
Very good. And what's about cardiovascular system?
Heart rate, cardiac output, blood pressure, and vasomotor tone decreases during sleep.
Decreases.
Decreases.
Okay. Next is slow brain waves sleep. We can see in which type of sleep? Yes, Anita ji. Slow brain waves we can see in which sleep?
In delta, ma'am.
In non-REM sleep we can see slow brain waves.
Okay.
Slow brain waves means theta or delta? Theta or delta brain waves. Okay. Hypnic jerks we can feel during sleep. In which stage of non-REM sleep we can feel hypnic jerks? Yes, Usha ji.
Ma'am, I can't remember it exactly.
Okay. Yes, Anita ji.
Stage 1, ma'am.
In stage 1, we feel hypnic jerks. Okay. And what's about hypnagogic hallucinations?
Those are
The ex-
strange
I
sensations.
think hallucinations are in stage one.
yes,
Hypnagogic
hypnagogic
hallucinations.
hallucinations are we experience in stage 1. Okay.
Yeah. They're characterized by some kind of weird sensations right now.
Yes, weird sensations. Next, the deep sleep covered by which stays in non-REM is RTG.
Yes, ma'am, it's a stage 2.
Okay, stage 2 and maximum stage 3 and 4. Stage 3 and 4 is recognized by deep sleep.
Okay.
Okay.
Delta waves.
Hmm. And as age is increasing, at stage 3 and 4, or we can see deep sleep is decreases. And which is also known as paradoxical sleep, is Simonology.
REM sleep.
REM sleep, very good. What is the full form of EEG? Anita ji,
Electroencephalogram.
very good. And what's about electromyography? Anyone else? Hands raised. Yes, Usha ji.
Ma'am, I didn't write that. You were a little fast and I couldn't write what electromyocardiography. I just wrote the name.
Okay, okay. Yes, Aarti ji.
It is for the test of the neuromuscular abnormalities. It is inserted into the skin to check the muscles.
We just check electrical activities in the muscles. That's it. And it's an invasive method. 2 needles we put in and inserted through our skin. Next is EOG. What's the full form? Yes, Simonology.
Electrooculography.
And what it measures?
Corneal retinal staining potential.
Okay. And if someone has disturbed disturbed or delta waves in disturbances, delta waves, then we can say which problem he or she can feel, can experience if the delta waves is disturbed.
Is it epilepsy, mental deficiency, depression, and
Depression.
Very good. If someone has disturbed or in this disorder gamma brain waves, then we can see or he can experience which type of disorder or which disorders.
Anger, anxiety, stress, ma'am.
Very good. Anxiety, anger, stress on peak or high BP. Okay. Next is now we are going to start sleep disorders. Today, anyone have doubt till now, they can ask me. Okay.
Ma'am, I have a question, but I don't know how you would understand that. When we are in a state of concentration, then the gamma waves in the brain are very active, right?
When we are, okay, please complete.
So my question is, all yogis, most of the Siddha yogis, they were in a state where they could attain siddhis and could see something which we cannot, the normal people
Hmm.
cannot.
Hmm.
So, for that kind of focus, when I am, as per my understanding, gamma waves increase that kind of concentration, right? But they enter
Hmm.
into a very deep state, like in delta waves.
Hmm.
These are two extremes.
Hmm.
So,
Okay.
what happens usually in that yogi's mind? How is he able to perceive things that we are not able to?
Okay.
That's
Ma'am,
my
I'm
question.
telling. Okay. I understand. Okay. Uh, I I want to clear this by a simple example that Einstein.
Yeah, yeah,
Okay.
ma'am.
Then so much scientists they have um we can say high power of imagination, thinking, or reasoning quality. Okay.
Ma'am.
We can say there in them um, gamma brain waves is more active in them. Okay.
Okay, ma'am.
Hmm. Or the saints or sages or maharshis which are going in deep sleep or in samadhi state, it means they are trying to slow their brain waves by only their thinking, by only controlling their sense organs. Okay. uh, so they want to slow their brain waves by only controlling their thoughts, thinking. Okay. And in other hand, beta or gamma brain waves are more active in those which are um, which are playing chess. Okay. Or we can say high thinking, high reasoning, high understanding, thinking ability, imagination. These are coming in gamma state. Okay. So all waves are must present in them. But what happen? Sages are control their sense organs so that they can go up to the highest level of gamma. They can also go up to the highest level of delta. Okay. Because of pratyahar, because of brahmacharya, because of tap, because of meditation, they can go up to highest level of both. Okay. But the normal person which are maybe we can see god gifted, which has high power of gamma brain waves, they can not, or they may be not able to go the highest level of delta. Okay.
Yes, ma'am. Yes, yes. The normal people, like the scientists and people who have made these discoveries and inventions and all that, their gamma is active, but delta might not be active.
Hmm. Or if that's there, those scientists are trying to start meditation or long term practice of dhyan dharana, then they also get more results in their researches, as they can go up to the highest level of delta, and they're also god gifted that they have beta and gamma high waves. Okay. And one thing is, you understand that we are in mid stage. Okay, as we start meditation, dhyan, dharana, and long practice, as we touch the delta waves in wakeful state. As we touch the delta wave in wakeful state, it means we can go up to the gamma also. Okay.
So from delta, with practices, we can go into gamma waves.
Yes.
Okay.
Just think why all yogis say that if you meditate or practice of dhyana, then you feel more concentrated, focused on in any work, or your cognition, your memory more strong. Why they say? Because we also know that in deep sleep, our cognition is more strengthens. Okay.
Okay, ma'am.
Hmm. So have you clear?
Kind of. Yeah, ma'am, we'll proceed with the class.
Hmm. So today we are going to start sleep disorders. So basically, sleep disorders are impairment in sleep. Okay, we do not getting sleep 7 to 8 hours daily with fixed time of fixed period of deep sleep. We are not able to take. Then we can say that we have a sleep disorder or impairment in ability to perform daily activities, or impairment in experience deep sleep, difficulty in sleep at least 7 to 8 hours, and also feeling sleepy in other day of or we can say in working hours. We feel sleepy. Then also these are sleep disorders. They are basically, maybe they are due to neurological disorders or psychological problems or diet, or we can say overwork, overload, overstress, tension. So these are cause. Okay, going to next slide. These are approximately there are 80 different types of sleep disorders. 80. Okay. The top ones are these: insomnia, sleep apnea, restless leg syndrome, narcolepsy, parasomnia, abnormal sleep behavior disorders, and night terrors. These are top most sleep disorders. Okay. Moving to next. And these are list of sleep disorders. First is abnormal sleep behavior disorders. Okay, we will cover it later it after cover this. Okay. Causes of sleep disorders: physical such as ulcers, or we can say any physical problem. Maybe this is internal or external. We can feel sleep disorders. Okay. If we have bloating, acidity, gas, then it is also showing our sleep. In medical such as asthma, so we can not take exact deep sleep because we have asthma. If um, our air tubes are blocked or lungs are blocked anyhow, any reason, then we can also not take deep sleep. We can wake up anytime. Okay, in night. And next is psychiatric, such as depression, anxiety disorders, environmental factor, working the night shift. Genetics, narcolepsy is genetic. Next is medication, some interference with sleep. Many diseases are okay. Many disease which interfere with our sleep. You know, many tablets we use while we have some headache, cold, cough. They just sleep, make us sleep, like headache. Okay. Should we move?
What is narcolepsy?
What's about narcolepsy? We will study in next slide.
Okay.
Just wait, okay. Symptoms of sleep disorders. These are symptoms that while driving you feel that you are sleepy, while watching TV you are just not so much active to enjoy every part of every daily activity. Okay, and you're just not paying attention or concentrating on your work, or you can not able to perform problems, reasoning, mathematics. Your memory may be loose. Okay, so these type of symptoms you can see. Next is, now we are starting, we will study main diseases. Okay, what is insomnia? So insomnia is just simply when people have difficulty falling asleep. Just see this, people have difficulty falling or staying asleep. This is insomnia. Okay, and just think, what's the cause before? What's the cause of insomnia? Just think that maybe uh, they have stress, tension, any type of tension, job work tension, workload. Okay, maybe fatigue. He or she may overwork 15 or 18 hours, 12 hours. Okay, and maybe his diet is not proper, he's not taking. Okay, uh, difficulty falling asleep. These are night and having trouble. This is symptoms of insomniac patient. Night and having trouble going back to sleep, waking up too early in the morning, having unfreshing sleep. Due to poor sleep, you are not just exact, you are trying to driving, you feel problem. These type of symptoms you can see in insomnia. Okay, so have any question in insomnia? You have? Anyone?
No, ma'am.
So they can ask question like, they can give 4 option or can say which disease is related with sleep disorder. Okay, and what is about insomnia disease and what's the reason? Okay, and they can also ask the yoga therapy here, that in insomnia what type of pranayam or dhyan we can perform. Okay, like we can start mantra jap, because after practicing mantra jap or yoga nidra or any dhyan, nadi shodhan pranayam, we get relief and just falling asleep. Okay, next is sleep apnea. Sleep apnea. What is sleep apnea? Sleep apnea is a sleep disorder that occurs when a person's breathing is interrupted during sleep. He is feeling some obstruct or blockage in their upper respiratory tract. in their upper respiratory tract. Okay. Any obstruction here? After that, they have obstructive sleep apnea. And what's about central sleep apnea? There is difference between obstructive and central sleep apnea. Obstructive sleep apnea means there are blocked airways due to uvula touching on your soft tissue. Okay, and your air are not find way to going inside. Your airways just block. Okay, here you can see in next slide. Here you can see the air are going inside from your nose and mouth. Okay, but as your uvula touches this, or your soft tissue of tongue is touching this uvula, then you feel, then your air are not passing there. And also this is the this is part of pharynx. Okay, maybe this also blow. This can also blow. So these are any type of condition. Maybe uvula touches this, or both touch each other, or pharynx blocked. Then we cannot get proper inhalation and exhalation. Lungs not get proper oxygen. And that's why in obstructive sleep apnea, people symptoms like snoring, okay, and wake up in mid of nights again and again. Okay, these type of symptoms you can see in obstructive sleep apnea is caused by blockages in the upper airway that restrict oxygen to the body. So due to blockage here in pharynx or by touch uvula to soft tissues, airways not pass inside the lungs. That's why obstructive sleep apnea happen. And person are snoring so much and just wake up again after a fixed time, wake up again. And also the partner also can feel disturbance by this. Okay, so this is obstructive sleep apnea. And central sleep apnea is related with our central nervous system. When central nervous system is also connected to our breathing. Okay, so our central nervous system, or the part which control our breathing, the part of central nervous system which controls our breathing, they are just forgot, we can say. They are not playing their role properly. Okay, that's why central sleep apnea happens. They are not sending signals to breathing muscles to breathe. Central sleep apnea occurs when brain's area that controls your breathing does not function correctly during sleep. And in this central sleep apnea, person suddenly awake, and maybe they can also face a stroke also, because here signals are not coming from brain. Okay, so in both cases, maybe patient can feel stroke. We had just listened that they go to sleep and not wake up next day. Okay, so this is central and obstructive sleep apnea. Okay, I clear here more exactly. Symptoms of Obstructive sleep apnea, daytime sleepiness, fatigue, restlessness, morning headache, irritation, anxiety. Morning headache is why? Because the patient or the person did not get proper oxygen into brain cells or anywhere in the body. Then they feel morning headache. Nighttime sleep, most main is loud snoring, gasping for air while sleeping. They feel okay. They're swallowing air again and again, and trouble concentrating in any work. Trouble concentrating, not good sleep, urination, and choking. Their throat or air tubes are choked. Okay, throat collapses. Okay, should we move?
Yes, ma'am.
So this is effects of obstructive sleep apnea on health. On health, what is the effect of obstructive sleep apnea? Not able to drive. Not able to drive. Maybe they get heart attack, stroke, paralysis, uncontrollable diabetes, BP, medication. They are the effect of obstructive sleep apnea. Because we know why these touch and why the blockage in pharynx. Maybe they have extra mucus. Okay. That's why they are getting blockage here. Okay. So if they have extra mucus or any type of what we can say, cholesterol in their tubes, side of their tubes, so their BP affects, their diabetes affects, and then if they both affects, then they can show heart attack, stroke. Okay. So should we move?
Yes, ma'am.
This is central sleep apnea. This CSA is the airway is not blocked. Airway is not blocked, but brain fails to tell the body to breathe. Brain fails to tell the body breathe. This type is called central sleep apnea. Okay, one more thing is obstructive sleep apnea is also known as hypopnea. Hypopnea. Okay, just one hypopnea. And next is central sleep apnea. Okay, have done. People with CSA may gasp for air, but mostly report recurrent awakening during night. Okay, because they are not getting proper oxygen. That's why awakens again and again, recurrent awakens. Okay. Next is restless leg syndrome. Restless leg syndrome, in which what happens during our sleep when we are going to bed, or we are just sitting in theater, sitting in office, or just sitting, so we can feel that some itching, some tickling effects, sensations on our legs that causes an intense, often irresistible urge to move the legs. We feel itching, tickling sensation in our legs. That's why we just again and again move our legs. Okay, like here is we thought in night also we thought that someone is pulling our leg, aching on our legs, throbbing effect, vibration effect. We just sensation like bugs are crawling under skin. itching effect, a feeling like an electric current. So these type of feelings or sensations we can experience in the restless leg syndrome. Okay. Have got?
Do these occur even during the wakeful state? Hello, ma'am? Ma'am, can you hear me?
Yes. Am I audible? Am I audible?
Now, ma'am, before you are
Yes.
not audible.
Okay. I'm saying that this is mostly this condition we can see in night during sleep, but in waking full state also we can feel the same problem. Like we just sitting, or we just driving, or at in theater, or at any time we are just sitting, so we can feel. If anyone have problem, they can feel these type of sensations. Okay. Next is, okay, this is narcolepsy. Narcolepsy is a neurological disorder, okay, of sleep. This is a sleep disorder because of neurological disorder. Okay, this narcolepsy we can conclude in sleep disorder and as well as neurological disorder, because they have no any problem in their sleep. They have a problem in their neuro problem related with neurological disorder. Okay, what happens in this? Your sleep affects. You are not able to control your sleep. Anytime, anywhere, in office, or while talking with anyone, or we can say uh, while looking movie, anytime you experience excessive daytime sleepiness. Excessive daytime sleepiness. If you get 1 or half hour to take rest, so you can rest. But in mid of the working hours, you're always feeling sleep. So just in every 5 minutes, or every the gap of 20-15 minutes, to you again sleep. Okay. Uncontrollable episodes of falling asleep during the daytime. Okay. So this is narcolepsy. Okay. Have done to all of you.
Yes, ma'am.
This is next is parasomnias. Parasomnias. Sleepwalking. Sleepwalking. Or misbehavior or uncontrollable behavior in parasomnias. Parasomnias are disruptive sleep related disorder. ठीक है? Abnormal movement, talk, emotions, and actions happen while you are sleeping. So during your sleep, you can feel these type of activities. Okay. And what about your partner? Your bed partner think that you are awake, but you are working you are all doing all work in your these because of these type of disorder. Your bed partner think that you are awake, but you are not awake. You are in sleep, but you have disorder. You are working like these activities. Okay. And these all are examples of parasomnias, different type of nightmare disorder, different type of nightmares, You experience sleepwalking, sleep terrors, different type of terrors you feel in sleep. Sleep related eating disorder, you just go in kitchen and every time you eat something in night. Sleep paralysis. Okay, so these are under parasomnias, and parasomnia are just disruptive sleep related disorder, and you do abnormal movement, talk, emotion and action in parasomnias. Okay.
Ma'am, they also eat as
Yes, eating disorder. They're just going in kitchen and open the fridge and just start eating anything and just again sleep. What?
Yes, ma'am. It's kind of
Hmm.
weird, but yeah.
You had you not seen this type
Yeah,
of
I've heard of walking and talking and people getting nightmares and all that, but people eating in their sleep, no, I haven't seen.
in many movies this has happened. In many movies they had shown that uh, they had parasomnia, that he or she just going in kitchen and just eating something and just again come and sleep, and in morning they thought I had eaten something, I had ate
Okay, ma'am.
something. Hmm. Okay, so these problems are coming under parasomnia.
Ma'am, can I ask one
Okay,
question, ma'am?
so there is division that
Ma'am,
parasomnia.
somebody has a question.
Yeah.
Ma'am, Anita, ma'am.
Yes.
If it occurs continuously, we can say it as parasomnia, or yearly once like that. If it occurs like that, means it is also parasomnia disorder like that, ma'am.
Yes, if someone is talking in during sleep, they can also come in that same parasomnias.
No, ma'am. I'm asking this
Hmm.
disorder, if it occurs yearly once or rarely, it also comes under disorder, or occasion, frequently, if they are doing alone, we will say it as disorder, ma'am.
Okay, listen. If they are doing these activities very rarely, so this is not disorder. Disorder is when your daily activity, or you are not getting deep sleep. It means you are getting trouble in sleep. Okay, you are not getting deep sleep. Every time you feel that these disorders, these activities,
Okay, ma'am.
every time of your sleep you facing that type of activities. Maybe you are uh, moving, walking in night. So in every night, or every alternate or 2 or 3 days, you walking. Okay,
Yes, ma'am. I
so
understood,
then
ma'am.
we can say that this is, they have problem,
Disorder.
they have.
Okay, ma'am.
Mhm. Next is parasomnias in non-REM sleep and parasomnia in REM sleep. If in a non-REM sleep, someone has parasomnia and they always performing activities in their non-REM sleep, then these problems are sleep terrors, sleepwalking, also known as somnam, somnambulism, somnambulism, confession arousal. Yes, confession arousal. In night they say, yes, yes, I do that work. I did that work. Okay, I did not. Sleep related eating disorder. These disorders mainly the person perform in their non-REM sleep. Okay. And nightmare disorders, recurrent isolated sleep paralysis. Again and again, recurrent, they feel sleep paralysis. Or we can say cramping in their legs, in hands. REM sleep behavior disorders. Some behavior disorder, maybe they can feel like I had read what is it? Sexism as like that. Okay. So any behavior disorder in REM sleep, these are coming parasomnia. Other parasomnia include exploding head syndrome, sleep enuresis, bedwetting, and one is sleep related hallucination. Okay. So this type of other parasomnias include. Okay. Anyone doubt or should we move?
We can proceed now.
Okay, so this is another topic. We will just cover it later. Now we going to list of sleep disorders. Okay, just understand these abnormal sleep behavior disorders. Okay, any type of behavioral disorder which are you doing in sleep, and that's abnormal. And bruxism. Bruxism is means uh, clenching your teeth. What we can say, crunching your teeth again and again or your jaw, and that is abnormal. Have you all understand about this?
Yes, yes,
Bruxism?
ma'am.
Yes, ma'am.
Okay, you just crushed your teeth again in recurrently. Okay, and next is central sleep apnea. We had covered this, and obstructive sleep apnea we had covered. Parasomnias, abnormal behavior during sleep. Next is periodic limb movement disorder, and one is restless leg syndrome. Both are nearly same. Okay, periodic limb movement disorder are um, a period of time, or we can say in specific period we are our limb movement we can feel. Also, we can say periodic limb movement disorder, like as we feel cramping in our legs, cramping in our hands, cramping in any nerves, in or any stretch in our muscles, leg muscles, then we can say periodic limb movement disorder. Okay. Next is chronic fatigue syndrome. Because of fatigue or extra workload or changing their lifestyle, then this chronic fatigue syndrome we can show, and it means not able to control our sleep during complete 24 hours. These are syndromes then we can see in chronic fatigue syndrome. Next is circadian rhythm sleep disorders. If someone is not able to maintain their circadian rhythm, okay, so that they can experience this problem. They are not able to control their circadian rhythm, or yeah, there may be any problem regarding their circadian rhythm. They are not doing uh, proper work. Next is non 24-hour sleep wake disorder. In complete 24 hours, we just feel sleepy. Excessive sleepiness, also known as hypersomnia. Same as narcolepsy. Just little difference. Narcolepsy is also known as excessive sleepiness, insomnia, night terrors, REM sleep behavior disorders. Parasomnia is under REM sleep behavioral disorder. SWSD, shift work sleep disorder. This is like shift work. If you are like guard or watchman, maybe your duty now shift in night, and after 15-20 days your duty again shift in morning or in mid of days. So your working hours is changing. Okay, so it disturb your circadian or biological rhythm. Next is sleepwalking, sleep related breathing disorder, movement disorder, sleep paralysis. So these are types, many types of sleep disorders. Okay, anyone have doubt?
Ma'am.
So this is complete your sleep and sleep disorder, types of sleep is covered. Tomorrow we start personality. What is personality? Nature of personality, determinants of personality, what is personality development, uh, according to different scientists, researchers, how they divide personality development. Okay, according to Sigmund Freud, according to Erickson, they are dividing personality in their own way. Okay, so we'll just understand these in next class. And tomorrow and I think Sunday, so sorry, Saturday. So tomorrow and Sunday we note class. Class is off. Class is now start in Monday. Okay, same timing.
Okay, ma'am.
Hmm. Thanks to all of you. Please sit erectly, eyes closed.